to Speak Our Minds, the fight for youth mental health, the podcast that delves into the inspiring journey of youth mental health advocates who took a stand and transformed a system. Together with your host, Heidi Baskfield, we'll explore the landmark lawsuit that held the state of Colorado accountable for failing to provide essential youth mental health services and won. In each episode, we'll unpack the intricate details of the lawsuit, guiding you through the legal battles and the monumental settlement that set the foundation for a working system of mental health. We'll examine the steps Colorado is now taking to build a comprehensive and effective mental health care system for its youth, highlighting both the challenges and the triumphs along the way. Join us as we learn from experts in other states who have successfully navigated similar crises, offering invaluable insights and strategies. Hear firsthand accounts from parents, providers, and professionals who are deeply committed to ending Colorado's youth mental health crisis. Their stories and perspectives will shed light on the impact of the lawsuit and the hopeful path forward. Whether you're a concerned parent, a mental health professional, or an advocate for change, this podcast is your guide to understanding the profound transformation taking place in Colorado's youth mental health landscape. Welcome to Speak Our Minds, the fight for youth mental health. Let's embark on this journey together.
I'm so excited to have Dr. Ron Lee Liaw, Mental Health in Chief for Children's Hospital Colorado and the Division Director of Child and Adolescent Youth Mental Health for the University of Colorado Department of Psychiatry, as our guest here today. Welcome, Dr. Liaw.
Thank you so much, Heidi. It's a pleasure to be with you.
Given that we don't have that much time and we have a whole lot of ground to cover based on all the places and all the tables that you sit, really where I want to start is let's talk about the fact that you're Colorado's only pediatric mental health in chief. How is your role helping lead the way for how pediatric mental health is being designed and delivered here in Colorado and actually to some degree the Rocky Mountain West?
Yeah, thanks so much, Heidi. I do feel like as the first mental health in chief for a children's hospital at the size and caliber of Children's Hospital of Colorado, I do feel it's quite an honor to be in this inaugural role.
You've been in multiple states and you've seen how systems in other states have worked in this space specifically and most recently in New York. When you got here, what surprised you the most about how Colorado was going about the delivery and sort of the system structure when it came to youth mental health care delivery?
Yes, there were so many things actually that surprised me. And I had done a fair amount of research about the Colorado youth mental health system and structure. I will say, just as a clinician, working in the emergency departments in New York City, when I had a kid who came in crisis with their families or referred by a school or a primary care provider for an evaluation for, fairly significant mental health conditions and challenges and risk, I had a sort of a toolbox of referrals and resources that I could offer families from the emergency room. So in New York City, they had home-based crisis intervention services where really as soon as I evaluated a patient and said they might be safe to go home, but they needed to have additional supports in the community and ongoing continuity of care, a team would be deployed across each borough in New York City based out of a hospital or a community mental health center that would go to the family's home and actually do in-home assessments, coordination of care, parent supports, youth connection to resources, and it was accessible to all kids, which was really incredible. We also had youth-centered mobile crisis teams. So again, our hospital team, I was at Bellevue Hospital in New York, had a mobile crisis team that, instead of kids coming to the emergency room, we would go out to them. And so you'd have a master's clinician go out to a school, to a home, do a crisis evaluation, and see what resources that we could put in place to help support that family through that crisis. I was really surprised. The other thing that we had access to were preventative services through the child protection teams in New York. They were called the Administration for Children's Services, is our CPS, is ACS in New York. There were prevention teams that would go out. So if I was concerned about a family, their ability to put food on the table in the mornings for their kids, their ability to maintain stable housing, if they were threat of being evicted. If there was some family conflict or stressors, we could call Child Protection Services and say, hey, could you preventatively, not in a punitive way, go support this family in need? When I got here too, I realized there were none of those services in place, designed for children, designed for families, accessible across the state, especially for those highest need kids. I think the other thing that was really shocking is that we had a state hospital system for children, because there are a lot of children who, a 1 week stay in a traditional inpatient psychiatric unit is not going to help stabilize their condition, their family situation, put the long-term care needs in place, and really help make sure that child has the services they need. We did not have any youth state hospital beds or the appropriate residential capacity or community-based intensive services. That's a lot of the kids that we see now in the children's hospital really need closer to home in the community. So I saw so many gaps, and I thought this can't be true. Like, they must have this service somewhere. This cannot be the mental health system for children of Colorado. And sadly, in the last 3 years, I've realized that is absolutely true. There are not the services that are needed. And that's why the families that brought the class action suit to Colorado Medicaid, to the state, were really a referendum on the lack of a children's system of care for mental health. And it's just been very eye-opening. I feel a lot more hopeful now than I did then. So hopefully we'll have a chance to chat about those things as well.
Absolutely. Well, it's interesting too, when you're talking about what you had available to you in New York, what do you feel like government leaders and those who sort of design, build, and operate that system understood differently about what kids need than what Colorado has understood?
Yeah, and I'll say I had a chance just a couple months ago to go back to New York and to meet with commissioners and state leaders in New York State. Things are really broken there as well. So I don't want to say like they've got it all solved, and there were a lot of resources too that we had available. I think the difference was that at the state level leadership, and this across the board, right, from the governor's office to the executive chamber to the commissioners and heads of major departments in the state offices and Medicaid, I will say this as well, office, they felt a responsibility for providing the safety net systems, for developing a system of care, for the accountability of the quality of the care. Like, some of the most innovative programs that I saw in New York in the 15 years that I was there were actually Medicaid waiver programs developed, where you could actually tap into federal dollars coming into the state through Medicaid waivers to design, for example, integrated models of behavioral health care in primary care, right? And in information technology advancements and in quality measures in mental health and in innovative models that you would have long-term investments and funding streams, as well as a workforce, as well as sort of the bricks and mortar infrastructure that you need to develop programs and to sustain them. In that way, I saw a very different approach in Colorado, right? It was about saving people money in healthcare, which is also really laudable, but it should be saving people money in healthcare while increasing quality and access of healthcare, while making sure that mental health needs and substance use needs are also cared for within the healthcare system. And that sort of accountability of making sure that we have a full continuum of care. It doesn't have to be like the bells and whistle version, but the basic safety nets of provision. I saw a lot of people kind of put their hands up and say, oh, I'm sorry, we've got a plan for that in 2, 3, 10 years. And for me, that's unacceptable. When we have children, we had 81 kids in the last year who were living at Children's Hospital Colorado, who did not have the appropriate community-based care or longer-term supports their families needed to bring them back to their homes and communities to really reach their potential in their lifetimes. And I just saw lots of folks in governments putting their hands up and saying, well, we just don't have it. I guess we don't have it. I guess we'll build towards it. And it just, the level of urgency and the level of accountability, of creative thinking and partnership that's needed at the government level to really address these issues, I just did not see them at the table a few years ago. I see that very differently now. I will say, I do feel like people are at the table who are driving change in a different way. I mean, there's lots of reasons for that. So some positive changes, but lots of not my problem. Talk to so-and-so, right? And that's just not the way that we should be caring for our children.
Yeah, well, I think that's right. I mean, I think the lack of urgency continues to be both shocking and disappointing when it comes to addressing things like how do you help and solve immediately for the challenges being faced by the 81 kids living in a hospital system, and how entire communities aren't saying that's just inexcusable. Again, I think gets us to this next question, which is there's plenty of places where the system here in Colorado is broken, has gaps, or missing pieces, which in a way creates its own debate about where do you start? What is the best starting point to begin to get things back on, and maybe not even back on track, but in a place to function well for the first time, perhaps ever? From the seat that you're in, because you're in so many of these different places where you get to see the impact and the challenges and are really trying to be a problem solver in those spaces, what would you advise as far as where are the best starting points to really bring things together to create long-lasting, meaningful change?
Yeah, well, I feel like one good thing about being, I think, as a state, a little bit behind the curve from some other states that have been out front is that we have so much that we can learn from the youth systems of care, mental health care, and continuums that those other states have built over the past 40 years plus, right? And so I will say when I first started in this role as mental health in chief, we set out to build a pretty ambitious, comprehensive, children and family-centered continuum of care here in the best possible way that Academic Medical Center, the CU Anschutz campus, and Children's Hospital Colorado could build. And there's certain pieces like some of our emergency care, our inpatient levels of care, our outpatient specialty care, and then our partnerships with primary care, with schools across the state, with early childhood centers, and then with other local and state and national partners. So we've been on a 3-year sort of march towards building our components of what we see as a system of care for children and making sure that those are high quality, those are funded in sustainable braided funding ways, that we have a workforce that's prepared and matches the demand and really looks at the full diversity of the mental health workforce, right? I'm the mental health in chief, not the psychiatrist in chief, because we have so many different disciplines and expertise within our team. And then really expanding that into a community mental health workforce, the family and youth peer support workforce, to spread our reach, but also to bring in really important information from communities about where the gaps are and what help would be timely and sensitive and culturally responsive. Where I think the state could really lean in now is we need them to really come together under the governor across all the different sort of agencies and departments where mental health lives currently, and all the different funding streams and people work streams, right? To come together to build a basic, I'm not even saying bells and whistles at this point, but the basic fundamentals of the children's mental health system of care. And I think you're going to be interviewing the commissioners from a couple of other states. New Jersey has an incredible child and youth and family centered system of care that now, in their multiple decades of building, all children in New Jersey can access. So if you're any parent with a concern about your child, if you're a school that has a concern about one of your students, you can access a single point of access, a single assessment process, and then your child can be connected and your family can be connected with an array of support services, regardless of if you have Medicaid, if you have commercial insurance through your employer, if you're underinsured or uninsured, they will help you. And they're blending the system of care and the financing behind that seamlessly for families. So families just know, this is how I reach out to the children's system of care. And this is how I access a whole array of services. And ideally, if Colorado can work across all of the different levers of government and with community providers and organizations and with payers, right? And with the Medicaid offices for funding and with federal waivers, we could build that system of care in the first 5 years, right? To be as good, if not better, than other states have. But I think we have to have a longer game, not a year by year. Do we have the budget for this in Colorado? We have to create that vision and we have to create that implementation plan and have the leadership will to implement that, even if it's not in my department or in my, in my year tenure.
Right. Well, and what a dream come true that would be, the scenario that you just discussed about parents and families and children and youth knowing where to go for help and knowing that there is a system there to rely on to serve them when that outreach is happening, which brings me to this next question around the class action lawsuit. You mentioned it earlier, and let's talk about it some now. Obviously, you're familiar with it. From your seat, what is your thinking about the role that this lawsuit, now settlement agreement, should play in helping do the things that you just discussed should happen?
Well, I did have the opportunity to sit in on one of the provider stakeholder sessions talking about the class action suit and the state's proposed implementation plan. The building blocks of the response from the state to these families and their attorney is actually, I think, core to building children's system of care here. Now, that's only for right now kids with Medicaid as their insurer. And after year one, there is not a clear funding source and plan for the type of work that needs to be done to be able to build off of the year one implementation plan. And so I did feel really hopeful, actually, as a provider, seeing the thoughtfulness behind the response and the plan proposed. And I think where the rubber really meets the road is how are we going to be able to really make those plans that are right now PowerPoint slides and, pages and pages of response into a real system, like a real care that families can access, real supports across the state, not just in one or two regions of the state when we have, referral and workforce capacity, but really for every child across the state. And I've been working a little bit with the Behavioral Health Administration, the new commissioner, Danette Smith, as well as she's evolving her thinking around a children and youth and family system of care and implementation plan. I would love to see both the class action lawsuit plan and the BHA or Behavioral Health Administration plans come together in a way so we're not creating redundant systems. I would love to see the people who need to be at the table as we're thinking about taking plans and making them real, like the people who actually deliver care and services, who actually navigate care, have families involved, have young people involved, have providers involved, and other folks, not just folks in government roles involved, because the government is not providing care right now. They are like they put out RFPs for grants or for provider contracts, but they're not really delivering care in the same way that other folks in the community are delivering care. So I'd like to see those stakeholders involved as well.
Yeah, and that's a great point. I think one of the things, when you talk about the stakeholder sessions, I agree with you that there has been some incredible thoughtfulness put into what state Medicaid is sharing as it's going out on the road and now doing these virtual learning sessions to present to stakeholders, including the provider community. And I also think what's missing is this role of co-design, because stakeholders, including experts like you, the only pediatric mental health and chief in the state of Colorado, not being officially named a strategic advisor, for example, it feels like an opportunity that it's not too late to put into place to say, we have some incredible resources already out in our communities. You are one of those examples, but not certainly the only one. And it feels like that is still a gap space that the department is saying, here's our plan. Do you have questions? Versus engaging people like you as co-design thought leaders in the way that this plays itself out. Do you feel like there could be a seat for you at the table? And if so, how would you use it and how you would support the state's efforts in this space?
No, thank you so much, Heidi. I think that, honestly, I'm fully 100% in for whether it's serving as a strategic advisor, but especially the co-design component of this work that I think you've identified as missing, right? We're sharing the plan with lots of different stakeholders, but the actual design of how this will work in our state, right? How this will work for kids and families in rural parts or frontier parts of our states, and Native communities, in ski towns, and urban, suburban areas, and farming communities, right? Like, how does this work? having all the key stakeholders involved in the design of the plans and of the implementation strategies and of all of it, workforce planning, you name it. So those, I think, over the past 3 years offered always to be a partner to our state agencies and departments. And sometimes you get put on what feels like a window dressing advisory that really has no real impact, and it's not timely. It's not the right setting. And I've offered a number of times, and I think many of us have, because the truth is the state's success is our success. Like, we cannot actually be successful as a community mental health center, as a children's hospital, as an academic medical center. We cannot be successful if the state is not successful in laying down the foundation for a children's system of care. And we can't do that independently. We have to do that together. So I love your idea and hope that this would be the next step, right? And maybe having a co-design table of key stakeholders, strategic advisors, offering their guidance as well and their lived and subject matter expertise. And also have the voice of young people and families. Like, it's so important, right? Like, many things that we would design in a conference room or on a whiteboard is not going to meet the needs. And so to have that voice core in that co-design process is really going to be important. And the other states have done that too. So we can follow those roadmaps as well.
Right. And not in like a temporary scenario either. Like, I get the complications of this process from the perspective of the state. They're on a tight timeline, and it isn't easy to think about how you effectively engage a very big, diverse audience and still meet deadlines. And yet I think the more effort that is put into creating this model of co-design versus Blue Ribbon Task Force versus window dressing advisory sets up the process to be more successful over the long term. And to your point, like, brings people along such that, as you referenced in New York, if things get off track, there's a structure there that helps bring them back online. So I hope that the state sees the expertise that it has and resources and people like you and engages differently and creates a co-designer process. And so with that, I'm going to bring us here to the end and say, and there's still things to be excited about. You have talked about some of those things today. If you had to say, give me the couple things, either that you're working on there at Children's and the University of Colorado or in the many other leadership roles that you have, what are you most excited about, and what has you the most hopeful about the future that you described about families getting what they need when they need it?
Yeah, thanks so much, Heidi. So there's two things right now that are really active bodies of work that our team is engaged in. And one is we're building out our strategy and a roadmap for prevention and early treatment of mental health, substance use, trauma-related conditions. And so in that strategic planning, the partners and the stakeholders that we're working with are in the primary care space. I was just on a meeting this morning with our primary care network called the Pediatric Care Network here, and pediatricians who have been doing their best and creating really impressive, innovative models of addressing behavioral health integration within primary care, and really learning from them and really seeing where Children's Hospital Colorado and the University of Colorado School of Medicine, Department of Psychiatry can partner to help advance their work, formalize their work, sustain their work, evaluate the outcomes of the work, and build off of national models for behavioral health integration in primary care. We're doing the same thing in schools, really unique partnerships across many different school districts across the state, and thinking about how do we bring the best of from an education perspective and from a healthcare perspective together at that interface where kids spend so much of their time, right, in school and in after school and before school activities. How do we really support mental health in those spaces? And then really thinking earlier in life in that sort of perinatal mental health and family support realm, as well as in the early childhood phase of life, 0 to 3, 0 to 5 age range, when so much in brain development is happening, so much in relationship development and stability of a family is so crucial. And how do we support families during that time of both incredible joy as also incredible vulnerability? I think that kind of work, plus thinking about like really different parts of a mental health workforce. The state always talks about, well, we have to have the workforce to do that. We have to have the workforce. And what I think we've been able to show here is we have the workforce, right? We've got people who are excited about entering the mental health field. And it's like figuring out, how do we meet people in community colleges, in their high school vocational programs, in mentorship programs in communities, and community health fairs? Like, how do we help get people excited and into a mental health career and help scaffold their growth and development through their careers and as a valuable member of our healthcare and mental health workforce team? So there's just so many things to be excited about. And that's where these are the types of things that I'd love to partner with the state on. If we've done it here, we absolutely can do this at a state level and different communities and regions across the state. So I'd probably leave you with those few thoughts.
Well, it's a ton of really exciting work that you're advancing. And I know we're all cheering you and your team on. And given how busy you are, thanks for being here today. And we hope you'll come back and keep sharing really exciting things that you're doing. And of course, I hope I get to have you back as a strategic advisor to state Medicaid in its process moving forward. So thanks for being with us today, Dr. Liaw.
Thanks for having me, Heidi. And thank you for your leadership as well.
Thank you for joining us on this episode of Speak Our Minds, the fight for youth mental health. We hope you found today's discussion insightful and inspiring. The journey to transform Colorado's youth mental health system is far from over, and your engagement and support are crucial in sustaining this momentum. If you have any questions, comments, or stories you'd like to share, we'd love to hear from you. Connect with us on social media or visit our website at www.speakourminds.org for more resources and information on how you can get involved. Don't forget to subscribe to the podcast on your favorite platform so you never miss an episode. Together, we can make a difference and ensure that every young person in Colorado has access to the mental health care they need and deserve. Until next time, stay informed, stay engaged, and keep advocating for a brighter future. The Fight for Youth Mental Health with your host, Heidi Baskfield. Thank you for listening.